I was diagnosed with stage 4 cancer in December of 2020. I was 32 years old. I did the things I needed to do. I ate well, I exercised, I drank the water, I went to my well visits. I had no known risk factors. I didn't drink or smoke. I had no family history. I had no symptoms. I went in for my annual well-woman visit, and that is when, during a pelvic exam, she felt a mass on my ovaries. And that was my first indication that there was anything wrong at all. We're like, okay, this is probably a benign tumor. We're going to move forward with surgery, take it out, on with life. It was after my surgery that I woke up to the news that my world was turned upside down. The tumor was malignant. They had to remove both of my ovaries, and there was further evidence of disease throughout my abdomen. The stomach lining was thick, and they took further biopsies. The working diagnosis was probable stomach cancer, which is something I had never even heard of before. So we went home, and it's hard for me to express what those next few weeks looked like for me and for our family. I was recovering from surgery. I was thrown into forced menopause. We were isolated because of COVID. And we had this huge unknown in front of us. I had my first oncology visit over Zoom, and that's when I received my official diagnosis. It was signet ring cell adenocarcinoma of the stomach. It was spread to the omentum and the ovaries. I was told that the disease is aggressive and that my diagnosis was considered terminal. I asked about my treatment options, and I was told that I was not a candidate for surgery because of it being stage 4. I was not a candidate for radiation. There were chemotherapies available to me, but those are limited. He encouraged me to pursue clinical trials and to take the time that I had while I was recovering from my surgery before I could receive any treatment to seek out multiple opinions, reach out to a liver cancer center for newer treatments and clinical trials. So that's what we did. I was a new cancer patient. I was very naive. I did not understand the qualification process. I thought, okay, you have a trial, I'm a patient, let's go. So we started the qualification process and the testing and the paperwork. We started thinking through the logistics of what it would look like for us to travel back and forth to Houston for treatments. And it felt really overwhelming, but we were really hopeful as well. I did not qualify for that clinical trial, and that was devastating and frustrating. I felt like I was back at square one. I did 8 rounds of flots and tolerated it pretty well. We did flot chemotherapy. The hope was that being more aggressive, I could potentially become a surgical candidate. I did not get that strong response that we hoped for. My scans were stable, but we did not see any regression. We talked to MD Anderson, and they presented me with 2 possible clinical trials. We immediately jumped at that opportunity again. Now aware of what that process looks like, we started the testing and the paperwork. I did not qualify for one of the trials, but I was accepted into the other one. And that has been my second line of treatment now for 2 years. And up until very recently, my scans were completely stable. Now we might be seeing a little bit of microprogression, but 2 years is a long time to be in that position. For someone like me who is diagnosed stage 4, At the time of my diagnosis, my son, my youngest, was 3 years old, and I was preparing not to see him go to kindergarten. He's in first grade, but I'm active in his life. I'm going to his field trips, and I believe that is to a large degree because I had access to this clinical trial. I'm really passionate about clinical trials. I think that they're really important for patients who have limited options. These are new treatments. We need more treatments. We need better treatments. And for that to happen, we need to have clinical trials and for those clinical trials to be accessible to people. So thank you for listening to my story.